So neck pain is a very common manifestation of people with orthostatic disorders, and it's important to go through because it's underreported, underdiscussed, and the treatments can be very helpful and also cause issues because often the treatments can be increasing fatigue, which is a dominant symptom. So let's go through mechanisms. So orthostatic coat hanger or coat hanger neck pain is common, like a coat hanger. You hang clothing. Worse when when you lay down, and um, worse when you are sitting upright. I'm sorry, and or standing up. Better when you lay down. So orthostatic coat hanger is this neck pain that increases like a coat hanger back of the head, neck, and it's to the shoulder blades, brow strap. Worse with sitting upright, standing up, this achiness, burning, stabbing pain. It can last. It's not always so tied into just changing positions. It can be chronic. It can go with activity down to the arms. So orthostatic coat hanger. And the problem is the muscles get so used to being deprived of blood flow, they become heavy, cause neck pain, headaches, arm fatigue. The muscles don't perform as well. So delayed or reduced muscle performance. People need physical therapy, sometimes muscle relaxants. The muscle relaxants, be careful to use because they increase the fatigue that you're using. So non-sedating muscle relaxants to review with your provider is key. Sometimes the muscles will start to spasm, and especially in the trap area and the scalene in the base of the neck, and you'll have that response because the muscles are just so dysfunctional. They have secondary issues of spasticity, dystonia, and have new problems that can develop also. That's important to address if that's becoming an issue. With that, then people develop neck positioning issues, restricted motions, head forward, the turtle, they call it. People with more sympathetic adrenergic tone issues, they'll have fight or flight, so neck muscles tighten up, head pushes forward, restricted motions, and the muscles tighten up. And the same issues of muscle relaxants, restricted range of motions, tightness in physical therapy, Botox, muscle relaxants. Often, again, all these patients, MRIs, CAT scans, X-rays don't show much of anything. That's because it's muscles, and you're not going to see things on testing outside the clinical exam. The thing about physical therapy and often massage and those treatments is that you have to be very careful. These patients, you have to be very gentle therapy, not overzealous. The analogy I use has to be gentle, almost like I always tell my patients, like ants moving an orange, very small movements, because these muscles are very much muscles that move the head forward, backward, sideways, rotation. So you have to make sure when they're working, get them back in balance, that you get that concert symphony very organized. Otherwise, you might increase more issues. Remember, neck migraines causes neck pain. Studies 40-60% of people with migraines have neck tightness. So migraines can cause neck pain. Some of the early manifestations of migraine are neck pain. So pay attention to that relationship. After a migraine, increasing neck pain can occur. And then lastly is cervical vertigo. Your neck can cause you to be dizzy. So if your neck is messed up, your neck tells you where you're going in space. There's impulse centers in your inner ear called the vestibular center. They get feedback to your brain. The muscles in your neck tell you where you're going. So if your neck is off balance, you're going to feel dizzy, off balance, and that can tie into why you feel that way. And that can require specific vestibular therapy to work on your neck. A lot of people go to vestibular physical therapy. The issue is their neck they find most of the time. So key points there. Thank you so much for listening.